to the Gut-Brain Connection. I am Dr. Wendy Romig with Sage Integrative Health. Just a little bit about me and Sage Integrative Health. I am the founder and the clinical director of Sage Integrative Health. We've been around for about 15 years now, and we do tend to specialize in a lot of gut issues, hormonal imbalances, anxiety, things like that. So I thought this would be a really great overview to bring to all of you today. And so this is a very quick lunch and learn half-hour overview. So we're going to just touch on a couple of key points around the gut-brain connection and some interventions, but this is not at all comprehensive. Like I said, this is just a brief overview. I wanted to give you all an introduction to the topic. And I am going to do a brief Q&A at the end, but I'm going to ask a favor that you can put your questions in the chat. So as you're, the one thing that's nice about putting your questions in the chat is that as the presentation is going, you can just drop a question in the chat for that section. And at the end, I'll be able to address all of the questions, as many of the questions as possible in the chat box. So just do me a favor and keep everyone keep your microphones muted coming in, and we're going to get started. So to understand about the gut-brain axis, we need to understand the science around it.
Thank you so much.
So the science around the gut-brain axis is really understanding the physiology and a little bit with the biochemistry as well. So we're going to talk a little bit about what the gut-brain axis actually is. So I'm sure many of you have probably heard of this concept, but maybe you weren't quite sure what it meant. So we're going to dive into that a little bit today. So the gut-brain axis, it is really a bidirectional communication system between the brain and the gut. And it's a really critical component to our overall health and well-being. You may have heard the term enteric nervous system, maybe not, or maybe you've heard the idea of the second brain. And so we all know that most of us refer to the brain in our heads, but the gut is really seen as a second brain because it has a very, very high level of nerve in the gut. So there's a lot of innervation, what's called, in that gut space. And that's why it's called the second brain, because there's so much nerve activity there, and neurotransmitter activity. One of the other things to know about the gut-brain axis is that 90% of our serotonin is made in the gut. And we know serotonin is very critical in helping with depression. Serotonin is actually a very critical neurotransmitter also for digestion. Another component of the gut-brain axis, is the vagus nerve, which acts as a messenger in the body. So I'm going to get in a little bit more on each of these topics. So the enteric nervous system, or the ENS, is one of 3 divisions of our autonomic nervous system. Now, autonomic means the part of the nervous system that we don't have control over. It's automatic. And these are things like our heart rate, our breathing. There's many other, liver detoxification. There's a lot of things that are part of our autonomic nervous system that hopefully are happening automatically in the body. And if they're not, then there's definitely a problem with the system. The other 2 components of the nervous system are the sympathetic and parasympathetic nervous system. And you may have heard a lot on especially the parasympathetic nervous system, because we are all trying to get a little bit more in the parasympathetic space. The parasympathetic nervous system is responsible for that rest and digest. That's going to be the side of the nervous system that's calming. It's going to enable us to sleep and to relax. The sympathetic nervous system is excitatory. That's going to be more from our stress response side. So we have the enteric nervous system, we have the sympathetic and the parasympathetic. So I mentioned that the enteric nervous system is known as the second brain because it is heavily innervated, meaning there's a lot of nerves and a lot of electrical activity and nerve activity and neurotransmitter activity happening in our gut. The enteric nervous system relies heavily on the vagus nerve. So the vagus nerve is really essential for our digestion. I'm going to get into vagus nerve activity in a moment. When we think about the enteric nervous system, we might think, oh, it's in the gut, but it's actually communicating constantly with our central nervous system via those two other systems, the sympathetic and the parasympathetic nervous system. But they have discovered that even if the vagus nerve has been severed, which means that communication is not happening, the enteric nervous system has the ability to operate independent of the vagus nerve. So these are some really important things to keep in mind. So the vagus nerve is a really critical part of this gut-brain axis. And there's a lot happening. There's a lot of activity out there right now about the vagus nerve and stimulating the vagus nerve. There's vagal nerve stimulants out there, like devices. There's a lot of blogs being written about vagus nerve. So that's another reason why I wanted to bring this topic to all of you today, is to get a little bit more deep into this. So the vagus nerve has a bidirectional communication channel between the brain and the enteric nervous system. So we're going from head to belly, okay? And the main controls, and I say main, but it's actually a lot. The main controls of the vagus nerve are digestion, heart rate, blood pressure, respiration, the immune response, our mood, mucus and saliva production, skin and muscle sensation, speech, taste, urine output. It controls our appetite. So the list goes on. There's so much that the vagus nerve actually handles in the system. So the kind of anatomy of the vagus nerve is that there's a right and left nerve. So one goes up, one goes down. So they have this bidirectional, and you can see from this picture here, the arrow's got a little bit cut off, but you can see that bidirectional communication happening there. So you have your right nerve on your right side and your left nerve on your left side. And they're going down into the gut and then also into the large intestines of the body. Here's just a graphic that gives you some sense of the bodily systems that the vagus nerve taps into and helps control. And as you can see, a lot of these are absolutely essential for life. So you can see why there's a lot of emphasis that's being put on the vagus nerve right now. It really has become such a point of medical interest because they're realizing that when there is damage to the vagus nerve, it's causing all of these other issues. And sometimes the issues are being treated, but the vagus nerve is not. So we'll get into that. So how do you know if there's a possible vagus nerve imbalance? Now, before I get into this list, I want to put out to you that these symptoms can occur for a lot of reasons. So if you have some of these symptoms, it does not mean necessarily that you have a vagus nerve imbalance. For example, abdominal pain and bloating can be the sign of poor digestion. It can be the sign of small intestinal bacterial overgrowth. It could be the sign of some sort of infection or H. pylori. So we want to be really careful when we're seeing these things. And even if we go into the Dr. Google realm and we're putting some of these things in, that a lot of these symptoms are general symptoms that can occur for many, many different conditions. But these are also signs of vagus nerve imbalances as well. So, as I mentioned, abdominal pain and bloating. Now, I'll give you some of the background on why some of these might be occurring to give you a little bit of a better understanding of the symptomology. Abdominal pain and bloating could be happening if there's a condition called gastroparesis. So this is why this is a symptom, one of the top symptoms listed here, because in the condition called gastroparesis, which is really it's paralysis of the stomach, which means that there isn't that peristalsis happening that is going to help the food move down, or the peristalsis might be blunted. It might be happening, but it's very minimal. So this could be causing pain and bloating in the upper GI tract because the food is not moving down into the small intestines. Now, Gastroparesis is a very, very serious condition. It can also come with vomiting, passing out. So those are some symptoms, but very mild gastroparesis could produce potentially just abdominal pain and bloating. Um, Another condition, acid reflux or GERD. Again, this can happen because there's insufficient stomach acid. It could happen because there is an infection like H. pylori. It could happen from a food sensitivity. So we really want to work with someone to suss out any of these symptoms if you're experiencing them. Again, acid reflux could be happening if there is some sort of gastroparesis situation in the mix. Now here we're getting into some interesting areas, changes to heart rate, blood pressure, or blood sugar. So as I mentioned, the vagus nerve controls, has that autonomic control system, meaning that it's dealing a lot with the autonomic nervous system, which is responsible for blood pressure regulation. It's responsible for heart rate. It's responsible for breathing. So this is where if there is a vagus nerve imbalance, there could be issues. Some people have dysautonomia where they they will get up quickly and faint, or there's a syncope, which is basically where they have a stressful event, maybe see blood, something causes their blood pressure to drop suddenly, and then they faint. So those are people that have those types of things, dysautonomia, a syncope, those can be potentially related to a vagus nerve imbalance. So that might be worth exploring. If someone has that condition of a lot of gas and bloating, their digestion's just not up to par, they're having dizziness, blood pressure issues, they're getting that that hypotension, the postural hypotension where you stand up suddenly and you feel very dizzy or almost pass out. This kind of case that we're building here could be starting to lead, if all those things are starting to happen in the same person, I might start to look to see, okay, this could be a vagus nerve issue, or at least dysautonomia. Difficulty swallowing or loss of gag reflex. This one's definitely can be indicated for vagus nerve because that's part of that stimulation, that's the peristalsis. And so the swallowing reflex can happen for a number of different reasons. There could be another type of nerve issue, could be another autoimmune condition, but we'd want to rule this out. Hoarseness, wheezing, or loss of voice. Again, this could be related. It could be due to allergies. It could be due to acid reflux. So loss of appetite, feeling full quickly, or unexplained weight loss. Again, this could be due to a vagus nerve situation where there is, gastroparesis. It could also be related to poor stomach acid where the food's just sitting there. It could be related to H. pylori infection or SIBO. It could be, SIBO can certainly cause unexplained weight loss. There could be something even worse, like cancer. So we want to really go through those symptoms, and then nausea and vomiting. So this gives you kind of a sense of some of the things, but I wanted to go through those item by item to let you know that as we're reading through this, if you're checking off a couple of these, to not immediately jump to vagus nerve imbalance because there could be other things involved, but they could. So it's all about knowing kind of the presentation of the individual person. There's 4 primary neurotransmitters that are produced in the enteric nervous system, and you've probably heard of a few of these, if not all of them. Serotonin is the big one that a lot of people do not realize 90% is produced in the gut. So why do we get so concerned if someone has chronic constipation? Why do we get so concerned if someone has a bacterial imbalance or what's called dysbiosis? We get concerned because it's oftentimes going to even manifest in depression. So the reason that this is happening, if serotonin is mostly produced in the gut, if serotonin starts to drop, if production starts to drop, serotonin, one of its jobs is to help with motility, which means constipation. And then we're going to start to see mood issues, sleep issues, poor appetite. So The other thing that we're going to see with constipation is we're going to see an increase in that toxic load on the body. If the body's not clearing the bowels out daily, then the body is holding on to potential toxins that are coming in from the food. So, of course, naturally, we want to try and get as much organic food in as possible, lower the level of processed foods in the diet, and I'll get into that in a little bit. But definitely, serotonin is a key one. GABA, you've probably heard of GABA. It's out there a lot. People talk about GABA. It's also produced by the gut, and specifically by the gut bacteria and the gut mucosal lining. This is in the small intestines. And it's mainly an inhibitory neurotransmitter, meaning it inhibits excitatory activity, and it promotes relaxation and sleep. Glutamate is also produced by the gut microbiota, and it helps with motility. And it is excitatory. It's also a precursor to GABA, but they are also they're antagonists to each other. They're opposing. Dopamine is about 50% production in the gut, and it's by the enteric neurons and by the intestines. And dopamine is responsible for our appetite. It is responsible for mood. Dopamine is often indicated in addictive behaviors as well. So now we've spent about 10 or 12 minutes on the science. Let's talk a little bit about what to do if one suspects that there is a gut brain axis imbalance. So here we have nutrition, and I think nutrition is probably one of the biggest areas that we can all really affect change. Nutrition is absolutely critical in helping to heal the gut axis and to really help stimulate production of some of those neurotransmitters that I mentioned to improve digestion. So we're really looking at those healthy fats, avocados, a little bit of coconut oil, flaxseed oil, fish. If you're pescatarian or eat fish, nuts, nut butters, seeds, things like that. We're also going to be looking at antioxidants, and the antioxidants are really critical. Why? Because they have phytonutrients, they have micronutrients, and they have anti-inflammatory qualities. So all of those things are absolutely critical for keeping inflammation down in the gut. They're also, many of these high antioxidant foods also have benefits for the microbiome. So we really want to eat that rainbow in our diet. So dark leafy greens, I have that highlighted, dark leafy greens. However, I'm going to put a caveat on dark leafy greens. It's summer. I'm a big farmer's market shopper. Every Saturday, I'm at my local farmer's market, and I am just filling my bag up with dark leafy greens. It's really critical. Most of you maybe some of you don't have the best digestion, but most of you might be trying to eat dark leafy greens raw. I don't recommend that unless it's something like arugula or maybe baby spinach. I do recommend doing a very gentle, light saute on your dark leafy greens. Your gut is going to digest them better. You're going to get more of those micronutrients out of them, and you might have less gas and bloating with some of those dark leafy greens. So get your dark leafy greens in. You can also put them in smoothies. That's another really great way to get dark leafy greens in. But I recommend a light saute, just even a steam saute. I don't even use oil. I just do a light steam saute with them, just a little splash of water, and toss them around with some other veggies, and then eat them, or you could do them in your smoothies. Other great antioxidant foods, butternut squash, which is we're a little early for butternut squash season. It's usually coming a little bit more towards September, October, but squash is great. We do have some summer squashes out right now, which are fantastic. Blueberries, strawberries, fruits high in polyphenols. So you're wanting to focus on these deep purples, the reds, the oranges, the greens. These are the colors that you're wanting to get into your diet because of those polyphenols and those micronutrients. The other component of your diet is to get complex carbs in. We're not saying that, having an occasional piece of homemade organic bread isn't okay, but the complex carbohydrates are what we're going for. That's going to be beans and, maybe some grains like quinoa, amaranth, teff, there's so many different ancient grains out there that you can select from. But the complex carbs is what we're going to be going for and really limiting simple carbohydrates like pastas, breads, crackers, things like that. On the probiotic prebiotic side of things, probiotic foods can be very beneficial. And um, there's a lot of different micro or bacteria that make up our microbiome. They're still counting them. There's so many. When we do our stool tests in our clinic, we do a full gut zoomer stool test, and it has, I don't know, 30, 40, 50 bacteria down there. These are ones that are part of the, the ones that we want to try and add the beneficial bacteria. So kefir is a great one. In fact, I've been more recently even recommending goat kefir for a lot of my patients. Yogurt is another one. I have a lot of patients that are a little bit more sensitive to cow's dairy. So goat milk, kefir, sheep's milk. There's a vendor at our farmers market that has homemade sheep's milk yogurt, and it's amazing. So getting some of those different types of foods in, sauerkraut, kombucha, kimchi, miso, tempeh is another really great option. It's a really great vegetarian protein as well. So try and get a little bit in each day. You don't want to overload your system with probiotic foods, because if you do have SIBO, which is small intestinal bacterial overgrowth, probiotic foods might actually make you bloat. So you want to be careful. So if you're finding that probiotic foods are bloating you or changing your digestion in a negative way, take them out of your diet for a little bit, and then you can talk to us and we get you back on track. Prebiotic foods are actually foods that help feed the existing gut bacteria. So probiotics are actually good bacteria coming into the system. Prebiotics are foods that are the fuel source. They're the food for those bacteria that are in your system. And there's a lot of different prebiotic foods. Asparagus. I love green bananas. I have half a green banana every single morning in my blueberry and goat kefir smoothie. It's my go-to in the morning. I love it. But a green banana is great. You're going to get those resistant starches in there, which is excellent for the microbiome. Artichokes, garlic, leeks, all of these things. There's also chicory is excellent, inulin, things like that. So there's a lot of prebiotic foods. If you're eating a diverse plant-based diet, that doesn't mean you have to be vegetarian, but plant-based meaning that you have a lot of fruits and vegetables in your diet, and a diverse number of fruits and vegetables, not just broccoli and apples. So we want to get a variety there. So we talked about the things to eat. Now we want to see what to keep an eye out for and really try and take out of our diet over time. We want to get rid of highly processed foods. And you've all heard this: shop the perimeters of the grocery store. As soon as you start dipping down the aisles and getting things that are in boxes, you're getting into highly processed foods. And highly processed foods are going to have more than one or two ingredients in them. You're going to just see a lot of stabilizers. You're going to see a lot of added sugars. You're going to see a lot of added salt and a lot of chemicals and things to help them bind. So we want to get out of the processed foods mode and really get into the whole foods diet. We also want to stay away from healthy fats. Of course, we know trans fats are horrible for you, fried foods, things like that. So sticking into the healthy fats like the avocados, your nuts and seeds are excellent. Really limiting sugars as well. A little bit of raw honey in a cup of tea once a day is fine, but eating a lot of sweets, putting sugar in our coffee on every day or a couple times a day or 3 times a day, those are all things that are going to throw off the microbiome in our body. And then the other component is alcohol. So alcohol can actually increase inflammation in the body. It certainly does have an impact, a negative impact on the liver. The liver is essential for digestion. So we really want to moderate our alcohol intake. There are a couple of nutritional supplements that I'll talk about, and this is just a small sampling of supplements. It depends on the person. And honestly, as a clinic, we are not the clinic that you're going to go to that you're going to get sent home with 15 supplements to take. We're really moderate with our supplement recommendations, for the reason that the body can't process all of them all at once. So if someone's taking 15 supplements, it's really hard on the gut. It's hard on the liver. It's hard on the kidneys because the body has to work really hard to get those nutrients. And especially all of those capsules are just not optimal. But these are a couple that I will use commonly in our gut health cases. Zinc carnosine is great. It's often used for healing the gut mucosal lining, and it can help with ulceration in the stomach. And it's just overall healing, not to mention the zinc is good for the immune system as well. Tributyrate. Tributyrate is a proprietary blend that is now being used by different supplement companies. It's butyric acid. The tributyrate is a really great blend of different forms of that butyric acid. Butyric acid is especially good for the large intestines. This will help with colonocyte production, in the cells of the colon. So tributyrate is also going to help balance the microbiome and help the microbiome keep healthy bacteria in there. Similarly, glutamate is oftentimes used for general inflammation. It can be used if there is a situation with IBS or even IBD, irritable bowel disorder, which is more on the autoimmune spectrum. So glutamate can also be indicated there. Another one is B complex. I put B complex in there because B complex, the different B nutrients are really excellent for liver detoxification and essential for blood sugar regulation. They are essential for the microbiome. The microbiome does produce some B vitamins, but B complex can also help to supplement that. Magnesium, we know magnesium citrate can be very useful for people that experience mild constipation. So we might want to look at something like a magnesium citrate. And there are actually a number of forms of magnesium, but specifically the citrate form is used most often for constipation. Magnesium is also very calming. It's relaxing. So it can help with constipation from that perspective too, but it's also relaxing to the nervous system, which is essential. And then, of course, probiotics. I'm not a fan of being on probiotics for more than a few months. If you've had to take antibiotics, or if you've had a colonoscopy, or there's something else that caused damage to your microbiome, or maybe we're going through a gut intervention and I'll put you on probiotics for a couple of months after we're finished with a gut intervention. But the risk of doing probiotics long-term is that you might be putting yourself at risk for SIBO, small intestinal bacterial overgrowth, because the probiotics in supplement form might be kind of hanging out in the upper GI, which we don't want. So just really quickly, I want to talk about a couple of areas for herbal medicine, and I am a clinical herbalist as well as a nutritionist, and these herbs I think are really critical for gut-brain axis. And we're looking at anti-inflammatory herbs, calming herbs, mucosal support, motility. So nervines, chamomile, lemon balm, adaptogens like ashwagandha, holy basil, rhodiola, these are going to be calming to the nervous system, the HPA axis, the hypothalamic pituitary adrenal axis. We're also looking at some gut herbs like slippery elm, marshmallow root, which are both good if there's any inflammation. Aloe vera also. Licorice root, also great for inflammation. It's also very healing to the mucosal lining. And then ginger, which is also going to help with healing, but also is very warming and can help with motility. Some other ones, anti-inflammatory herbs are licorice root, as I mentioned before, gotu kola, turmeric, and ginger. These all have excellent anti-inflammatory qualities. For motility, people that are experiencing slow gut, maybe not necessarily constipation, but maybe they've done a transit test and noticed, oh, wait, when I ate beets, it took 2.5 days for those to show up in my stool. That's a problem. So they may be having regular bowel movements, but their bowels are not evacuating. They're very slow. So we can lean into things like triphala, which is an Ayurvedic blend of 3 different herbs that can help improve motility. It helps with the microbiome. Also, bitters compound. A lot of our patients are on either triphala or bitters compound or both. Bitters compound is a blend of bitter herbs that will improve digestion upstream. And then ginger. And then we mentioned some of the nervines, the things that help with mood, like lemon balm, passion flower, St. John's wort, and hawthorn. So lastly, looking at this whole conversation, lifestyle considerations, things that you can do in your everyday life to help with that gut-brain access, to help with your vagus nerve. You can limit alcohol to 2 glasses per week. That might seem very strict, but that would be the optimal recommendation. Alcohol can be very toxic to the body, and like I said, it can impair liver function and digestion. We want to go for exercise that's moderate in intensity and resistance training. Why do I say moderate? Because moderate is going to be sustainable long term. If we go for high intensity activity, we might be increasing cortisol. We might be putting ourselves more at risk for injury. So I say moderate intensity activities and resistance training, which could be anything from body weight exercises to weightlifting. I also recommend Tai Chi or yoga several times a week. Meditation, journaling, it's a great way to relieve stress. Really try and get 7 to 8 hours of sleep per night. That's kind of the sweet spot as an adult. Anything less than that, you're putting yourself potentially at risk for sleep deprivation. And then getting counseling for stress or trauma management. And then there's actually exercises that can stimulate the vagus nerve, chanting, meditation, singing, humming. These are all really great things that you could do every day, gargling, that can help stimulate the vagus nerve. So with that, I am going to open it up for questions. And by the way, this is our team of nutritionists here. We have a great team. And I invite any of you to schedule a 15-minute free phone consultation with us. I'm currently not seeing new patients. I'm more in that role of clinical director, but everyone else is, and they're fantastic. Also, we do have a referral program. So those of you who are current patients or have been a patient with us in the past, if you refer someone to us and they sign on, you will get a gift and they will get a discount. So that is available as well. So what I'm going to do now is I'm going to just take a peek at the chat and see what kind of questions we have. And if there isn't, if there aren't too many more questions, then let's see. We've got a few here. Okay. So if there aren't too many more questions, then what I will do is just wrap this up for today. So blood pressure issues, high blood pressure or low blood pressure. So with blood pressure, that can happen with the vagus nerve. Sometimes what can happen is that if there is a vagus nerve imbalance, what I had talked about with that, the orthostatic hypotension, this is where there's a sudden drop in blood pressure. So the blood pressure issue is not that one has chronically high or chronically low blood pressure, but the blood pressure will suddenly just plummet due to a vagus nerve imbalance because of certain activity. And so that's more of the blood pressure issues that we are looking for. So are there any other questions out there before we finish up for the day? Okay, great. Giving you another minute to see if anyone else has other questions that you'd like to put in the chat. Okay. If you don't have any other questions, I want to thank you all for coming today. It's always a pleasure to share with you. Like I said, feel free to reach out to us at sageintegrativehealth.com. You are more than welcome to touch base with us if you have any questions. And I will be putting this up on YouTube, so this should be available as a replay in the next few days. So you can go to the Sage Integrative Health YouTube channel. Again, I'm Dr. Wendy Romig. It's a pleasure to be with you all today. Have a wonderful day.